Um,
Started.
okay, so welcome everyone to the Social Service and Health Committee meeting. My name is Bonzara Oni, and I am the chairperson of this committee. Appreciate you all for joining. This is our first call of the 2025-26 session. So officially call this meeting to order, and then we'll start with the roll call. Before we get into the roll call, Ms. Lyons, can you let me know how many people let me just give background information. So for everyone on the call, a struggle that both this committee and other committees have had is people sign up for the committees but don't attend. But if they're considered members of the committees, then we are looking for a certain number of people on each call to have quorum. And our committee has like dozens of people signed up, and we usually get like 4 to 6 people on the call. So the board is planning to purge members and instill a new level of commitment for being considered a member of the committee. And I believe the official rules, people have to join 2 consecutive meetings and be approved to be a member of the committee. So we're not waiting for people who are never going to show up in order to reach quorum. So Ms. Lyons, could you let me know the number of people that we have that we're considering a member of this committee and what number we need for quorum?
You have, I believe, 60 something members, but I sent you the list. Did you see the list that I sent you with the attendance? Miss Oni?
Sorry, I was muted. Yes, I remember you sent something over the summer.
Yes.
Um, so I guess my question is just, did you officially purge those people from the
I was told not to touch the list because Mr. Daly was working on something.
got it. Okay. Okay, that's helpful. So I guess I will talk to Mr. Daly to figure out what number we're gonna start with as our baseline, but that would mean that if we're still counting the 66, so then today we don't have quorum, which
Right.
is fine, but good to know. Okay, thank you. So moving forward, I'll start with the roll call. If people can introduce themselves, I'll call your name and just introduce yourself and your connection to the community and or committee. So starting with Ms. Reed. Ms. Reed, are you there?
Sorry. Good night, everyone. My name is Janice Reed. I'm a committee board member.
Thank you. Sabin?
Good evening, everyone. Sabin Jha, community board member. I'm a community member.
Thank you. Amanda?
This is Ms. Reed again. Correction. Sorry. Committee member, not community board member. Committee member.
Gotcha. Okay, thank you.
Yes. Hello, this is Amanda Bilal, and I'm the Community Development Specialist at Bridging Access to Care.
Awesome. Welcome. Vanetta?
Yes, here, present.
Could you say your first and last name and your connection to the committee?
My name is Vanetta Sylvester, and I'm a member of the Health and Social Services Committee.
Awesome. Thank you. And Ms. McCain Brown?
Good evening, everyone. Monica McCain Brown, committee member.
Welcome. Thank you.
Yes.
So the next item on the agenda. Sorry, I was looking for the attendance. The next item of agenda would be the chairperson's report. So that would be my report. As I mentioned, this is the first meeting of this session. So not much to report as far as community dealings. We are having our second annual board fair on October 18th, which is a Saturday. We will not be able to meet with this committee before then. So definitely I would like to know who is interested in participating, but the board the board office has been hard at work in securing vendors. We have lots of city agencies, healthcare agencies planning to come and just share information on community resources with people in East Flatbush. So it will be on Utica Avenue between Church and Linden, Saturday, October 18th from 10 to 3. If you are able to attend on the day of to support with manning the table, handing out papers, greeting people, etc., please let me know. If you know any organizations that might still be interested in showing up, we still do have plenty of space. So again, please let me know and we can reach out to them and confirm their attendance. And that ends my report for today. Does anyone have any questions?
Yes, I'd like to add, this is Amanda.
Yes.
So my agency, Bridging Access to Care, I
Mhm.
believe we are going to be attending and tabling.
Okay.
And I think I'll just follow up on the back end. And because we do offer free testing as well, we have a mobile unit. So I think I'll reach out on the back end and see if that's a resource that you guys feel would be valuable. At
What
this,
kind of testing do you offer?
HIV, Hep C,
Okay.
and um, and they're free, and STI
Okay.
as well.
And when you say you have a mobile unit, is it like a truck or something?
We have two. We have a truck, and we do have a Sprinter.
Okay.
So the truck, it's about 40 feet, and we do have just a regular Sprinter, but that's just yeah.
Okay. If the Sprinter
So
is available, we would absolutely welcome it. I just
okay,
know last year some organizations wanted to do some testing, but then they only had open tents. So then they felt like it wasn't private enough. But we do have plenty of space. It's quite a long street, and we had a lot of empty space last year. So we would welcome a Sprinter. I think a truck would be a little bit too big, but we can definitely fit a
understood.
Sprinter.
Okay,
Yeah. So if that is a resource that's available, we would absolutely love that.
phenomenal. I'll follow up on the back end.
Okay, fantastic. And so just to confirm, you'll email me or the district manager?
Yes.
Okay, fantastic.
Thank you.
Thank you. Anyone else have thoughts or questions about the resource fair?
Yes, Ms. Owen, this is Mrs. Reed. Is there a deadline for vendor to respond to confirm that they will be like to participate?
We ask by the end of the month, by the 30th, but honestly,
Okay.
because the goal is really to have as much resources as possible. Last year we did have some last minute confirmations and we still tried to accommodate them as much as possible. But like by the 30th would be us being able to guarantee that you have space. If,
Okay.
we have too many and then someone reaches out like October 5th, then we might just have to say no.
All right, thanks. Appreciate it.
Of course. Did you have an agency in mind?
Um, I was thinking, I'm a member of a nursing organization, so I was wondering if we could try to participate and do blood pressures, that kind of thing, but I have to find out what their if they'll be able to participate. So
Yeah, if anyone has availability. If they have availability, please just let me know. We definitely would
yes,
welcome.
we'll do. We have a meeting on Saturday, so I'll
Okay,
find out what their thoughts are. Get back
perfect.
to you.
Thank you.
All
Thank you
right,
so
thank
much.
you.
Of course. Okay, so that ends my report. Next on the agenda would be approving the minutes, but unfortunately, we do not have enough people on the call to approve the minutes. I do see that someone else joined. I can't see what your full name is. Could you introduce yourself for the record, please?
Okay. I believe you're referring to me. I'm Dr. Omar Chukwueze. So I'm here. So this is my first time in this particular meeting, and I'm a member of the 67 Precinct Clergy Council as well as many other organizations. Thank you very much.
Fantastic. Could you just repeat your name, please? Sorry.
Omar Chukwueze.
Omar Chukwueze. Okay, welcome. Thank you so much for joining. We appreciate you. So we were just talking about, or I just gave my report, which is basically focused on the community resource fair that will be held on October 18th. So I don't know if the 67th Clergy Council is planning to attend or send any representatives, but you all are definitely welcome. I know many members of the council are friends of CB17, so we would love to have you.
Okay, thank you
Okay,
for the information.
of course, thank you. So next would be approving the meeting minutes, which we cannot do because of our attendance, but hopefully by next week we'll have the attendance rules cleaned up so that we can approve meeting minutes. And then next would be new business. Does anyone have new business that they would like to share with the committee? Nope. Okay, so hearing none, I guess I do want to open the floor just to ask, seeing as this is a new year, if anyone on the committee has desires of the committee for what we can accomplish this year. I know we had some ideas last year that we weren't able to execute. So I really want this to be a fruitful year. We also are bringing on some new members of the actual community board. The first vice chair, Trisha Lewisan, should be joining us by the next meeting, and then also some new community board members are being assigned to this committee. So hopefully we have more hands on deck to execute some work. So I would just like to open the floor to see if people have ideas for outside of this fair, and then the April Health Fair, which I would like to reinstate. What ideas people would like for the committee to execute, because typically we just do a couple events, but I think there's more potential for us to have more reach within Community Board 17. All ideas are welcome.
Hello,
Yes?
this is Vanetta. I was just thinking that there's so much misinformation out there now. It's, today, from our own government, in terms of, putting out things that don't really have any evidence. As example today is
Mhm.
the whole kerfluffle about Tylenol and pregnancy, which is totally not warranted because there's no data to support what's being now put out by the government as fact. So ways to like educate the community and reach out to them, and make sure that they're getting like truly unbiased information.
Yeah, I think that's a really great point. Question, do you and other people on the call receive the board email, the newsletter that comes out?
Yes, I do.
Okay.
Yes.
I'm thinking, sorry, go ahead.
No, I was just saying that yes, I do receive the board email.
Okay, fantastic. So I think
Newsletter.
maybe if we have a section, we can include a section in the newsletter to start as, with like health information and, to your point, specifically responding to some of the news that's coming out. We do have several medical professionals from like SUNY Downstate or other local facilities who have offered to support our work. So maybe we can reach out to a few of them that might be interested in like writing a paragraph or two when necessary, and we can include it in the newsletter, and then maybe moving forward also in some printed materials.
I can write some things too because I'm also a physician, but I don't practice it directly in Brooklyn anymore. So it would be
Oh,
helpful to
okay.
have some information from downstate in terms of where to send people if they're interested in
Mm-hmm.
getting further treatment. Things like vaccines if it's become a big issue. Also, making sure that people who actually need to get vaccines are getting them. And where they can go if they're having issues getting vaccines from like the big pharmacies. Because I had that issue myself this past week. So
Okay, yeah, we have a downstate liaison who who I work pretty closely with, so I could reach out to her as well to see if there's like an info resource at downstate, but would definitely love if you're willing and able could just be a paragraph. I just wouldn't feel comfortable being the one writing it since I'm not a physician, and it would just be my opinion and Google. But if you are, willing to support, I think that would be a great idea. So I'll reach out to Ms. Frazier to tell her to expect it, and then you and I can connect over what we think the content could be for the next edition of the newsletter.
Okay, that's fine.
All right, great. Thank you. Any other thoughts on the role that this committee can play within CB17 for this year?
As you know, I tend to say this repeatedly. For us to play a role, we have to have that bi-directional relationship with the community from the leaders higher up in the healthcare. In other words, whether it's OBH talking, I think it's just very important that we have representation of people who are bringing things to our attention. As you know, because it's so broad, right? And so I've always been a big advocate for guest speakers to come and let us know, because, there's so much information out there. Like I can tell you, like, because I'm part of a garden community, I may hear something. Because I'm walking, somebody might give me a flyer. I'm just saying that I know we try to narrow our scope, but I think it's always great to have, whether someone from DOH, whether somebody from OBH, I always encourage those individuals who have a voice and something has not been brought to your attention, so that we know, because there's so much out there these days. Whether it's, as we talked about, misinformation, whether it's guest speakers. So I'm big on the usual. That's what I'm saying. That's it. Thank you.
Understood. So, are you thinking like inviting more health speakers to the big meeting, the monthly board meeting?
Yeah, I'm big on the people who are able to ensure that changes are implemented and executed, but at the same time, just letting us know, because this is a core group here. It's the same core group that we work together. Even like I heard the list is pretty big. And so some things may not come to your attention. You might be, oh, okay, I didn't know. And it's okay, because there's so much out there is what I'm saying. So however we get somebody to make sure that they come here and they speak and just keep our ears, aware in the community, that would be helpful.
Yeah, I do understand and appreciate that. I know we have each hospital has what they call the CAB, the Community Advisory Board, and CB17 has a representative that attends the Brookdale CAB, but last year that person stepped down, and then a new person stepped in. So there was a lack of continuity there. And then Brookdale also didn't have the meetings regularly. And then for Kings County, because they're technically just across the street in CB9 has a CAB. So I've been trying to get contact information so that person can either attend this meeting or send a report. So I'll follow up again to see if we can just get more regular CAB reporting at this meeting. I think that could at least be a start.
Thank you.
Of course. Anyone else want to share any thoughts?
Ms. Reed, perhaps you can also maybe have perhaps guest speakers at this meeting to kind of spark the interest and increase participation versus the general meeting. Because I know the general meeting is usually very tight, and usually, it's a specific schedule, so you really can't fit speakers there. But I think having a guest speaker to this meeting on a specific topic, whether it's a physician, social worker, or someone from the Department of Health, that can also to be beneficial as well.
Yeah, I do like that idea. We did try last year with the board intern to help us set up regular speakers, but I think she just stopped working sooner than I was aware of. So the project just didn't get completed, but we do have a list of potential organizations, and I think the organizations that are going to appear at the board fair would be a really good basis to reach out to. So I will add that to my list. And again, what I'm trying to do this year is not have everything be on me, because I don't want to, just fall through and then things not happen. So when we get more community board members that are members of this committee, I might assign some of this out to them to make sure that the stuff gets executed. Okay, any other thoughts before we move on to unfinished business? Hearing none, moving on to unfinished business. Is there anything that was started last session that we have not covered? Okay, hearing none. I would just again like to ask you all to, share information about the board fair. I'll make sure that the flyer is emailed to this list as well, so you all have a digital copy of the flyer. And let me know if you're able to attend on the day of to support, and I will be assigning out just roles, like have people at sign-in desks and things like that. Even if you can just come for an hour or two would be really helpful. And if you know anyone who'd like to participate, and it does not have to be health related, it's just a resource fair. So we have housing organizations, finance organizations. So again, if you know anyone who does good work in the community and would like to come out, please let us know, and we'll send them an invitation. So with that, thank you all for your time. Welcome again to this this year's session, and looking forward to a really productive year with you all. And can I get a motion to adjourn?
We're gonna make a motion to adjourn the meeting at 7:58 p.m.
Thank you. Is there a second?
I second it.
Thank you so much. The motion has been moved and seconded. Declare this meeting adjourned. Appreciate you all. Ms. Lyons, can you just stay on for a second, please?
Sure.
Thank you. Have a good night.
Thank you.
Good night.
Okay, good night.
Thank you
Take
so
care,
much.
Good night,
guys.
everyone.
Bye.
Good night.